Hello, I'm Dr. David Hornbrook, the Clinical Director of Education and Technology here at Keating Dental Arts in Irvine, California. Today we are going to utilize the TrueDef from 3M digital scanner to fabricate an all-ceramic crown on Kim, our patient, maxillary left canine. And we're actually going to do it modulus, which is very cool, so it's going to be a virtual impression. I'll go ahead and scan it, scan the opposing, scan the bite, send it off to the dental lab as well as 3M. They'll make a virtual model, they'll trim the dies virtually, they'll fabricate the crown utilizing CAD/CAM technology, and then we'll have them back and we will seat the crown. So we removed an existing crown that Kim had actually fractured. So we go ahead and re-prep to clean it up a little bit. The margins were placed subgingival from the previous dentist. So just as with our analog impressions, we need to have good definition of our margins, and we need to isolate our margins. So I'm not a huge cord packer. I like to use a laser and then a Kaelin putty like Axis Edge, and I'll show you what that looks like. So this is the AMD Picasso light. It is a diode laser. Kim, let me know if you have any sensitivity at all. And we're actually going to trough almost as if I'm packing cord. Okay, I'm going to have... Okay. So the nice thing about using a diode laser, it actually will stop bleeding, it'll cauterize tissue. It actually works more efficiently when there's a little bit of bleeding. But I'm able to take this tip, and this is 300 microns, down into the sulcus and just create a trough, just as if I pack cord, but it's really atraumatic. So there's a little bit of what we call laser char. And so we just take hydrogen peroxide, and this is just in a syringe with an alternate tip, and we just remove that. So now we have our margins exposed. Again, just as I'm packing cord. With the Picasso light, the diode laser, he'll have no postoperative pain with this at all. And then I'm going to use a material called Axis Edge, and it's available from Centrix. Turn toward me just a little bit. And this material is a Kaelin putty, and it expands as it gets wet, so I just inject it into the sulcus. Again, atraumatically, this is great around implants. Stops bleeding, it expands, retracts the tissue. Typically I'll leave that on for about 3 minutes. And then we'll rinse it off and do our scan. Alright. Turn away from me a little bit, Kim. Now, since we're doing the maxillary canine, I would like the scan to at least go from second bite to second bite. I don't have to do a full arch at this point. I could, but there's really no reason to. I want to be able to articulate this, and I want the ceramics to be able to see the contralateral canine so they can match contours. So we're going to go ahead and scan the lower now. Open real big for me. I'm going to have you take a mirror and just pull back his cheeks. Now, a lot of the digital scanners say they don't need powder, and that's a nice feature, but honestly, they will get a better scan if they actually have powder. You know, the powder of the early scanners was very difficult to use and messy. The TrueDef uses powder, but it's really a silicone, and it's almost like a light graphite. And my goal with this is to only basically powder areas that have reflection, and these would be shiny surfaces. So typically on a prep that's dentin, it's not shiny. I hardly have to powder that at all. So I'm powdering facets, all ceramic crowns, enamel that looks shiny. Let me just have you hold this a second, Jessica. I'm just going to air dry this. A very light dusting. Okay. I'm going to go ahead and, oops, I'm going to erase, yeah, that is lower. I'm going to go ahead and grab the camera. The nice thing about this TrueDef, it is the smallest camera on the market, and it's moving video. So you can see here, as it goes from gray to red to white, I'm capturing the image. Wherever there's voids, it means that I'm not capturing the image. and at any point I could stop and start over or add to it. So if my patient had a gag reflex, I could stop, take a break, and then come back to it. This can be manipulated. You can see I didn't get the lingual surfaces at all. So I'm just going to scan and add to what I already did. So I'm going to go back to some section in the mouth that the computer recognizes. Okay. So I did this section to the buys, and I'm going to recapture that area there. A little bit of shininess, so we're going to spray again. I go ahead and take the wand, the camera, find a place that the camera or the computer recognizes as a reference point, and then I just go around the arch. I'm going to go to the second buy on the other side. It's very, very fast. In fact, the computer itself and the scanner is faster than I can probably even move it to capture the image. Anytime I get lost, when it turns gold like that, it means the computer doesn't recognize anything. I can go back to a section that it does recognize, and it'll stitch this together. So I lost it. I can come over the cuss tip, come onto the facial, and grab the rest of the images. And at any point, I can come back, take this out. If I make a mistake or I have some sort of area that didn't scan well, I can actually go in and erase that last part of the scan. So we're a little shiny there. That's why we're not getting a good scan, or I can manipulate it. It could be the angle that is giving me those areas that it doesn't recognize. So I'm going to come back to find a spot that the camera recognizes and then move forward. The cuss tip on that canine, obviously important. We'll just move it back and forth. And let's go ahead and save that. And you can see as we manipulate our scan around, this isn't a real problem, but I don't like the way that it looks, so I'll just fill that in. And I'll get the cuss tip of this canine because this is going to be articulating with the opposing canine. So let me just have the pattern. I'm just going to zap that. These are all ceramic crowns, and so they tend to have a lot of glare and reflection. That's why we're going to zap these. So I'm going to do this as well. We have up to 7 minutes to scan, so we have a lot of time. I'm at 1.5 minutes. So we're going to find an area that the, whoops, let me go back to that. Okay, so we'll just eliminate that little part. Okay. All right, so I'm going to go back, and again, the computer is going to find an area that it recognizes, and then I'm going to grab that cuss tip, and I'm going to grab the facial surfaces. And you can see as soon as the computer or the camera, the software, does not recognize part of the teeth, it'll turn to that gold. So I know I need to go back and find a section of the arch or a section of a tooth that it recognizes. So we'll go ahead and save that. Make sure we have enough data so that the lab can articulate it and also get our function. Okay, let's see what that looks like. We have a nice digital scan. Again, I could go to full arch. I really don't need to, just because he's in contact in all his teeth. We get a nice clean scan. This can either be sent to 3M and I can have a SLA, stereolithography model made, and the lab can then make that off of a model, or we can do it model-less, which we're going to. All right, let's go ahead up to the upper arch. We're going to go ahead and rinse our Kaelin putty. Again, that's Axis Edge from Centrix. Several different ones on the market. One of the first ones was Expacil by Kerr. Very, very nice material. Much more expensive, and you have to use their guns, where I can just use these tips, disposable tips, single-use tips, and I can put them in any CR syringe. Whoops, a little bit more. So I'm going to go ahead and put just a dry angle back here to keep the cheek out of the way. And then I want to have them stay open, especially gunpowder. I don't want it to get wet. So I'm going to give them a bite block. Open as wide as you can, Kim, and bite down. Is that okay? Mm-hmm. Okay. Your job is to make sure you keep your tongue down as much as you can. Okay. Light dusting of the powder. Again, these are all ceramic crowns, so a lot of reflection here. Okay. All right, let's go ahead and begin our scan. Now we have the option of either with the touch screen pushing the play, or there's an option where I can double tap this and that'll activate and shut off the camera as well. I prefer the screen. A lot of clinicians prefer the double tap. Let's go ahead and find our occlusal surface. There it is. Go back to the molar. Again, I like to run along the occlusal surfaces and incisal edges first, so they always have a reference point in case I lose my position. You can see how fast this is, the scan. And that was the complaint with a lot of the original digital scanners, is they were so slow. And you can see where I lost my place. So we'll go ahead and find the occlusal surface. Again, lost my place. I want to make sure I get an accurate representation of the proximal surfaces of the adjacent teeth, since that's where our contact is going to be. I'm just going to go to the second bye on the opposite side. I want to get a good scan of the contralateral tooth, since that's what we're going to be matching. Again, I can go back, and if I lose my spot, anywhere that the scanner recognizes, I can find my spot. So there, it's not recognizing that. I want to get this inside the ledge. Good. Let's see what that looks like. Now, if we get these arrows, basically we get an error message, incomplete scan, add the coverage. So the computer is not recognizing these images as a complete image. So which means I need to go back and capture. It's saving it there for me. It needs to find the relationship from the facial to the lingual surface here. Let's see if that did it. Good. Okay. I'd like to just get this right here so the mounting, otherwise the computer will cut that premolar off. So the problem is the bite block was keeping the scanner from getting back that far. So open real big for me. Just have a little bit of powder right there. Let's see if that did it. Good. Perfect. All right, so we got our maxillary scan with the prep. We got our mandibular scan. Now we need a bite relationship. So this is the left side, so we're going to put left. And what we're going to do is just spray the buccal surfaces a little bit again. With the ceramic, it's shiny. We go and have the patient bite down all the way. Go ahead and bite down all the way. And I just need 2 or 3 teeth. Again, so once the computer recognizes this, I'd like to get down to the gingival margins, both arches. We'll just bring it forward. And let's see if we got enough of a bite. Perfect. So we can actually go in there and we can check clearance at this time if we need to. We can blow it up if we need to see it. Great. It's a great looking model. Again, this can either be an epoxy model via SLA or virtual, and we're going to have it virtual. All right, let's go ahead and mark our prep. It's going to be maxillary. We're going to add a prep. That tooth number 11, check. We can then go in and verify that we have margins. We can actually make it 3D if we want to. Perfect. Great. And then we write our prescription. In our prescription here, we have the option of of the date that we want, what lab. Obviously, we're going to send it to Keating Dental Arts, no models. All right, so we're going to request it next week. We're then going to have a full coverage crown. Push OK. It's going to be tooth number 11. OK. Our material is designed. This is a single material. We're going to do all ceramic. If we have a certain preferences in occlusal clearance, the opacity, the occlusal staining, we can actually type that in, and that can actually be our default. We're actually going to utilize zirconia. So we'll put other. We're going to use the KDZ Bruxer Ultra, because what he has now are zirconia that are overlaid with ceramic. So at Keating, that's our Ultra. So we will go ahead and type in what we're going to do. It's going to be a KDZ Ultra. Okay. Shade guide. We're going to use the Vita Classical to match his existing restorations. And our shade is B1. We're going to go ahead and sign, confirm, put in our super secret password. And then this is sent to 3M and to Keating Dental Arts. Okay. When this becomes completely green, it means it was sent and accepted. Okay. So we're done other than making a temporary with Kim. What we're going to do in the continuation of this video is we are going to actually run you through the process of what Keating does with that information as they design the crown. And then we will see the restoration next week.